Good morning, everyone. My name is Dr. Andrea Tooley. I'm an ophthalmologist from Rochester, Minnesota, who treats thyroid eye disease, also known as TED or TED.
And I'm Beatriz, but you can call me B. I'm a passionate advocate for this disease and also a patient diagnosed 5 years ago with Graves' disease and thyroid eye disease.
Welcome to the fourth episode of TED Today, a special daily show we created for the first ever TED Awareness Week. Each episode will include important information for those living with or caring for people with thyroid eye disease, also known as Graves' eye disease or Graves' ophthalmopathy. But if you have Graves' disease, it's important to listen because up to half of people with Graves' disease will develop thyroid eye disease.
And as we continue to raise awareness of thyroid eye disease during this first ever TED Awareness Week, in today's episode, we will be focusing on building the right care team and also being your own best advocate. Este programa es totalmente en inglés, pero si necesita recursos en español, por favor visite la página que se indica en esta pantalla y ahí encontrará recursos que le puede ayudar.
We have an excellent lineup of guests and information today, including a step-by-step guide to building your care team, how to be your own best advocate, and an interview with Jeff Todd, the President and CEO of Prevent Blindness, sharing information and resources for patients living with thyroid eye disease. So, without further ado, let's learn about building our care team. Thyroid eye disease is a very complicated disease, and it's best treated with a whole team of specialists who have special training and unique abilities to help get you the care that you need and follow you throughout the course of the disease. If you have Graves' disease or Hashimoto's hypothyroidism and you develop any changes in your vision or any symptoms you're concerned about, it's very important to make an appointment with a TED specialist so that you can get a baseline exam and then start a treatment plan if that's what you need. TED specialists are usually special trained either neuro-ophthalmologists or oculoplastic surgeons. And these are specialists who have had extra training in TED patients and are very well equipped and comfortable to handle the disease and monitor you throughout the course of your disease. For example, I'm an oculoplastic surgeon, and so I spent 2 additional years after my ophthalmology residency specifically learning about the eyelids and the orbit or the eye socket and all the tissues that can be affected in thyroid eye disease. I treat many patients with thyroid eye disease, and so I'm very comfortable managing the complicated nature of the illness. TED specialists see the most patients with thyroid eye disease, and they're the most comfortable managing these complicated problems. And so it's important to see a TED specialist to get a treatment plan that's right for you. When you first have a baseline eye exam or a comprehensive eye exam for thyroid eye disease, you're going to go through a ton of different tests. We want to know all kinds of things about your history, such as when your thyroid disease started and what kinds of things you've experienced or how you've been treated for your thyroid problems. And then it's very important to know about your eye disease. What eye symptoms have you been having and when did your eye problems start? Then you're going to have all kinds of tests. We'll check your vision, we'll check your eye muscle movements, and you might even see a specialist like an orthoptist who can further kind of grade and test your eye muscle movements and help you if you have any double vision. We'll check the pressure in your eye, we'll do lots of different measurements of your eyelids, we'll measure how far your eyes are kind of bulging if that's something that is going on with you. Then we'll usually do a dilated eye exam and look in the back of the eye at the optic nerve and the retina. You might even get other special tests like a visual field test, which tests your peripheral vision, or even an OCT scan of your optic nerve. There's all kinds of really important tests that help us determine where you are in the course of your disease and how it's affecting your eyes so that we can decide the best way to treat you. In addition to getting all of these tests as part of your comprehensive eye exam, it's also important to work with your endocrinologist. We'll often order additional blood tests and blood lab monitoring to make sure that your thyroid is appropriately controlled. We all work together as a team to make sure that you get the care that you need. Remember, if you are having symptoms of thyroid eye disease, it's so important to make an appointment with a TED specialist so that you can get the appropriate care and monitoring that you need. To find a TED specialist, you can go to teddoctors.com.
Now we're going to have a conversation about how to find the right care team. To do this, I have asked for my friend Laquilla to join us today. How are you doing, Laquilla?
I am wonderful, B. How are you?
I'm fine. Thank you for asking. I know you to be such a strong advocate, but it's a journey to get to the right care team. What was it like for you to actually find the right care team? What did you have to go through?
Well, B, was actually a few stages. The first thing I had to do was not take no for an answer. After I was told no so many times by this doctor, that doctor, saying I would never be able to see again because of TED, which is Thyroid Eye Disease, I had to begin to advocate for myself. It wasn't until my primary care physician, I went to him in October of 2006. In less than a month, I had already lost 100 pounds. And I wasn't sleeping. I was running off of pure energy. He said, "You have hyperthyroidism. This is why you've lost all that weight." He referred me to an endocrinologist. That was the first step. The endocrinologist that he referred to me was not the doctor for me.
How did you know that he was not the right doctor, that he was not the right doctor for you?
His mannerism. He was very standoffish. His attitude really was not pleasant, put it that way. So I started advocating for myself, and I started looking up my own endocrinologist. It took me the third doctor was a charm. His immediate response to me was, "I need to get you some help." He looked at my eye. At the time, I was wearing shades, so when he made me take my shades off, that's when he realized I needed some serious help. So he referred me to all the ophthalmologists that I had been seeing.
I know it's been a tremendous journey for you, full of a lot of difficulty and a lot of pain. How did you keep your spirits up as you went through this? What was it that worked for you to be able to stay uplifted, to be able to face every day of this journey?
In order to get where I had to be, the pity party had to take place. In other words, when I say pity party, I had to cry it out. I had to scream. I had to get it out of my system. So I began to think positive. Like I told you, no was not an option for me. I started to journal all my symptoms. So when I did find the right team of doctors, I had everything written down that they needed to know, and I would journal my symptoms on a regular basis because I had highs and lows and didn't know which way I was going. So after I did that, I began to listen to music. Everything was positive. I don't care what they said. I began to keep an open, positive mind. And from there on, it was just no stopping me.
You are a true inspiration to all of us. Thank you so much for sharing.
You're very welcome, and thank you.
For our final segment today, we're joined by Jeff Todd, the president and CEO of Prevent Blindness. Hi, Jeff. Thank you for joining us.
Hi, thanks for having me.
Can you tell us about Prevent Blindness?
Sure. Prevent Blindness is one of the nation's oldest organizations dedicated to vision and eye health. We address all eye health conditions, and we do this across all age groups. We focus on public policy, advocacy work, public health, public education, and patient engagement.
That's wonderful. What resources do you have for patients with vision impairment such as thyroid eye disease?
We have an entire section of our website that's dedicated to thyroid eye disease. You can find this at preventblindness.org/thyroid eye disease. On that section, you can find infographics, you can find patient fact sheets, or other resources related to the disease.
Great. And how could people get involved with your organization?
You can get involved with our organization locally by becoming a vision screener or public health educator, or donating to our organization through our donate section of our website, or finally, by becoming a public health advocate. We have an advocacy section of our site that will give you more information on that.
Great. And where could viewers go to learn more about Prevent Blindness?
Viewers can find out more about Prevent Blindness at preventblindness.org or through our social media channels on Facebook, Twitter, Instagram, or LinkedIn.
This is great information. Thank you so much, Jeff.
Thank you.
Thank you all for joining us, and we hope you enjoyed today's episode of TED Today. Join us for tomorrow's episode, where we dive deeper into the mental health and wellness aspects, how to manage both your body and mind when living with thyroid eye disease. See you tomorrow.